The pandemic has had ripple effects on almost everything, including blood donations. Between staffing shortages and COVID restrictions, blood banks have had trouble getting the supplies they need. Touro internal medicine physician Dr. Schuyler Williams joins us to talk about this very important issue. Dr. Williams, good morning to you. What's causing the shortage?
Well, good morning. Since the start of the COVID-19 pandemic, there's really just been a significant drop in the number of blood donations. There's many reasons for this, but a few I'll highlight is that, there's been less of the traditional blood drives, at large organizations such as, businesses, schools, and places of worship. But also there's been high rates of COVID, and so the donor turnout has been lower than before as well. So for a lot of different reasons, but unfortunately we have seen a big drop in the number of blood donations since the start of the pandemic.
So obviously it makes it, the individual donation, the person just going to the blood center, kind of more important to the equation since we're not having these kind of big events?
For sure. So, you can look online and find out where your local blood bank is so that you can find out where you can donate blood. And I encourage anyone right now to do that. If you've never donated blood, it's quick and easy. So consider if you've done it before or even if you might just be eligible to do so.
Is there any particular type of blood that's needed, or is it kind of across the board?
Well, right now there's a severe shortage of all blood types in our nation. So looking for all different types of blood. In particular, there's a big need for type O blood, which is considered the universal donor. That's because type O blood is able to be donated to anyone, regardless of your blood type.
We have these stories from time to time, and there's a tendency to kind of have things go in one ear and out the other, and people are busy about their lives, that sort of thing. Is this more acute this time, Dr. Williams, than in general? Like, how severe is the shortage?
Well, I think that the shortage is really impacting hospitals and physicians, in particular, in being able to manage urgent needs for patients. So the supply chain issue is really having big effects on the healthcare system. And it's overall a dangerous scenario for our patients, especially ones in the hospital who are in desperate need of these life-saving units of blood.
And that's the thing. I mean, if you get to a point where, what are the consequences if we don't turn this around?
Well, it's going to mean that we're going to be making a lot of tough decisions and, delaying surgeries if we don't have enough blood to be able to continue with the surgeries we're offering. Patients who are even getting cancer treatments, a lot of them, require blood transfusions as a part of their regular treatment. So it might mean delaying cancer treatments as well. So huge implications with this blood shortage supply. So I think the take-home message today is to really consider donating blood if you're eligible to.
All right, Dr. Schuyler Williams from Touro with that important message about donate blood if you can. Dr. Williams, thanks for your time this morning.
Thanks for having me.